Hi friends, today I am going to talk about artificial tears. They are also known as lubricating eye drops or lubricant eye drops. They help keep the eyes moist and relieve dryness by adding ingredients similar to the tear film. This helps the tear film and protects the surface of the eye. So what are the three layers of the tear film? The outer oily lipid layer secreted by the meibomian glands. Then comes the watery aqueous layer secreted by the lacrimal glands, and the inner mucus layer secreted by the epithelial cells of the conjunctiva. Dryness can be caused by, I'm going to enumerate six main causes. First one is aging. Then second comes medications like diuretics, beta blockers, allergy medicines and sleeping pills. Third is medical condition. There are several medical conditions such as diabetes, Sjogren's syndrome, thyroid disease. These can cause dry eyes. Fourth, meibomian gland dysfunction or the fat gland dysfunction. When the tiny oil glands in the eyelids don't produce enough quality oil, tears evaporate too quickly, causing dry eyes and irritation. The fifth cause is a prolonged exposure to screen. So prolonged exposure to screens, because of a reduced rate of blinking, there is an inefficient moistening of the cornea and this leads to dryness. The sixth is the environmental cause or environmental factors like smoke or wind, air conditioners and central heating. These can dry out the tear film quickly, leading to dryness. There are two main types of artificial tears. The first one are drops with preservatives. These come in multi-dose bottles and contain preservatives to prevent bacteria growth after opening. However, they may irritate the eyes, especially if you have moderate to severe dryness or if you use them frequently. The second type is the preservative-free drops. These have fewer additives and are recommended if you use artificial tears more than 4 times a day or have very dry eyes. They often come in single-dose vials. There is a third type for more severe dryness. These are thicker lubricating gels or ointments. So these can help in severe dryness. They stay in the eyes longer, but they may cause temporary blurriness, so they are often used just before bedtime. Artificial tears may be bought without a prescription. Several brands are available, but no single one works best for everyone. So you may need to try out different ones to find out the best fit. So when should you use preservative-free eye drops? So preservative-free eye drops reduce the risk of eye irritation and infection. Artificial eye drops for more than 4 times a day for a long time, you should go for preservative-free drops. But if you use them only a few times a week, then drops with preservatives are fine. Also, regarding single dose versus multi-dose drops, preservative-free drops come in single-dose vials or multi-dose bottles. Single-dose vials lower the risk of contamination but are more expensive. Multi-dose bottles are more cost-effective and eco-friendly when made with the latest technology. For daytime, basically drops are best for daytime use as they don't blur vision. And gels, because these are thicker than drops and they offer longer relief, but they may cause slight blurriness, so better to use them just before bedtime. So try lubricating eye drops for work, while reading and for driving. Very severe form of dryness, then it's better to use the gels or ointments at night time before sleeping, because number one, they have a longer period of action, and number two, they cause temporary blurriness, so it's better to use them just before bedtime. So I hope this will help you when you're using artificial tears. Stay tuned for more updates. Thank you.